Welcome, ladies, to yet another episode of WonderWoman Wednesdays with a focus on women's health, specifically gynecological issues. As a New Year greeting, we say to our friends, I wish you health, wealth, and happiness. So today, let us start with a special focus on health. My guest today is Dr. Cherry Shah, who featured in our Dynamic Duo series as well. Dr. Cherry Shah is one of Mumbai's highly accomplished gynecologists. She has been featured successively for over 10 years as one of top gynecologists in Mumbai by the India Today group. She has a huge list of who's who and celebrity clients. What I love about her, besides being on top in her field, she's a Sanskrit scholar, an amazing cook, and a life of every party because she loves to sing, dance, and recite great shairi. Welcome, Dr. Cherry. Thank you for making time for us during a time like this. I know I have pulled you out from a very, very busy schedule, and thank you so much for being here.
Thank you, Mandeep. It's always a pleasure, actually, interacting with a group of women and working again as a teacher, because I guess every doctor basically is always a teacher. So that's why. But I am very happy to be here to be able to share whatever I probably can about what would make it easier for a woman to go through the stages, because especially for a gynecologist, a woman at any age, whether she's a young girl or a woman who's trying to get pregnant or who is pregnant, or a woman who's now transitioning into a menopausal stage, each age is extremely important because at each age, a woman has so many transitional medical hormonal issues which come into play, which if used rightly can just go fine and you don't need any doctor for that. But particularly as time has gone on, we've kind of lost touch with our bases, with our basics. So therefore, it becomes a little more essential now.
So, Dr. Saab, I'm going to start with the first question, which some moms have who have daughters. At what age the visits to a gynec should ideally start for a young girl?
There is this transitional age when they start getting the menses. The first thing that a woman or a mother feels is that my daughter should get regular periods.
Yes.
And she kind of pushes the daughter, and she lands up with maybe some doctors who are not really aware of it. And so therefore you should choose whosoever is your gynecologist, who's a little, to use a colloquial word, tehra hua, in the sense who doesn't jump to give you medications easily, who kind of traverses you through the physiology of it. So that is the age at which I feel perhaps a girl should be brought by her mother. And that is just as a basic examination, a basic health point of view. Because when they're in the transitional phase, the first thing that every mother should also know is that whenever a girl starts a menarche, whether it's at 12, 13, or 10, it takes 6 to 8 years before the hypothalamic pituitary axis actually becomes stable. That means every girl is going to have irregular periods, and the mother should not worry about that. But what she should worry is that if with those irregular periods, her daughter is sprouting a mustache or a beard, or she's having longer sideburns, or this was something very simple, which was told to me by my mother-in-law. The first time she saw my daughter was that her thighs, her middle part of thighs was darkening. So she said, why is it happening? And that's a very early point a mother can pick up that her daughter is perhaps going to get PCOS. If her underarms are getting darker earlier, at the age of 12 or 13, that's a time that you can start thinking that perhaps I should be very careful about my daughter's overall lifestyle, which would perhaps make it better for her. So I guess the transitional phase would be when they start their menses. Before that, the child is anyway with a pediatrician. So that's good. So 16, 17, 18. There's one big red flag that you should always have. If you find that your daughter is in the lower 5th percentile of height, this is the time when you can actually treat her and increase her height.
Oh.
So if she's 13, 12, 13, 14, and she's in the lower 5th percentile in her class, average height ka pata chali jata hai na? So that is the time, that's a red flag. You should immediately see a gynecologist or a pediatric endocrinologist. Because when the epiphyses, that's the bone epiphyses, have not fused, That's the time when you can actually give injections and increase the height of these young girls by 2-3 inches.
Oh my God. Oh.
Yeah, that's the time you should be really thinking, because afterwards you can't do anything about it.
Yeah. Dr. Saab, now that a lot of girls seem to be getting sexually active earlier than earlier times, what advice can mothers give to their daughters from a health and safety perspective?
Health and safety, yeah. I always feel that there are two aspects to this advice. I mean, as a mother, you want your child to be safe. And there is one aspect is the aspect of, it's not sanskar, if you call it, it's the basic safety. A girl who's getting sexually active, if she's given the understanding that it's okay, the problem is that she lands up in lots of issues. I mean, how broad-minded or whatever you are, it does happen. So therefore, from the safety point of view, the first thing is to make them understand that, beta, this is a natural aspect of our growing up. A sexual desire is a natural aspect. There's nothing shameful about it. The way I teach it to my young girls, when they come, I tell them that, look, you have electricity around you. Electricity gives you so many advantages. You have a fan, you have an AC, you have a computer, you have lights, everything. So you really kind of, this is one of the energies which you kind of really revere. But that does not mean you touch a live wire. You know that if you touch a live electric wire, you're going to get electrocuted. Yeah, sexuality and sexual urges are just about at the same level. This is how you could probably explain it to them. My granny used to always say that idiots make their own mistakes and wise people learn from other people's mistakes. So that's what. Yeah,
I think you were talking earlier that a lot of the girls do not have the courage to talk to their parents, so they don't have that.
Yeah, it's very difficult because they view their mothers as absolutely stupid, or they view them as dragons. So it's a difficult thing to match. But I guess, giving them the comfort, Kibita, I'm there for you. Tell me what it is. I'll help you out, whatever it is. It's just between you and me kind of a thing. Probably would help. Probably.
Dr. Saab, there's a lot of information out there now on endometriosis, PCODs and things like that. And I mean, have the cases increased, or is just that more awareness is there?
No, they have really increased. When I was doing my MBBS, MD, we used to see, in a week, we would see just about 2 cases. Now we see 2 cases in a day. I mean, imagine in a hospital OPD with so many people. I think the basic problem has been lifestyle changes, which are immensely different now. And I would say, the fact that pesticides have been used all over, the fact that people are using hormones to increase even a simple thing like milk. Why we are actually suggesting to all our patients to go off milk is because the milk that you're getting is most of the time from buffaloes and cows who have been hormonally fed. And that particular hormone works like a growth hormone in girls and women, which increases your insulin sensitivity and makes you more prone to getting PCOS and other diseases. So it's all the you can say all the muck that is going down in terms of plastics, in terms of hormones, in terms of drugs, in terms of the overcrowding, in terms of what fruit you're eating, what vegetables you're eating, what has been used in the soil. They're using fertilizers, which are chemicals. So all of these things have led to definitely a lot of increase. And lifestyle, the biggest difficult lifestyle is no proper time to eat, no proper time to sleep, everything is kind of mechanized now. You use a car, or you use a bike, or you use something like that to go from place to place. You don't walk, you don't exercise. So all of this has made a difference. We definitely see more cases now.
So because these cases are also related to infertility besides so many other factors, would you want to kind of share some examples with our members so that the younger women who are either wanting to conceive or have gone through these issues, they can relate to it?
Yeah, see, the first thing that I find is that as soon as they have, I had quite a number of girls used to be working in these, what is it called, those late night
Yeah, the BPOs, yes.
BPOs, yeah. So they would be working there, and they, because they got good pays, they would start work at about 7:30, 8 or 9 in the night, and would be working till 5 a.m. the next day, and they would sleep in the day. And gradually, over a period of 6 months or 1 year, they would start becoming very obese. Not only that, they would start getting irregular periods. And they would have, when we did the hormones, we found that the androgen hormones and the other hormones were all irregular. And the basic reason is because there's something called melatonin, which is very important to your healing process. The moment your body does not get to produce melatonin. Now, what is very interesting is that you can only produce melatonin if you go to bed by, say, the amount of melatonin is only produced in the night. It's produced only in a dark room. And suppose you go to bed by about 9:30, 10, you have to go to rapid eye movement. That's your deep sleep mode, which comes after 2 hours. So that means 10 baje aap sone gaye, the 12 o'clock your melatonin starts getting secreted. And the moment the first ray of sunlight comes out, which would be at 6:30 or 7, it stops. So if you sleep at, say, 10, so you get 12 to 7, you get your melatonin. If you sleep at 12, you get it from, say, 2 o'clock to 7. If you sleep at 2, you get it from 4 o'clock to 7 o'clock. So the number of hours of melatonin are very important. The more you have it, you heal better. Now, this is one thing. The second is eating the wrong things. Now, that I do not blame many people, because everybody's on the run. You just grab a bite or whatever is easily available in your canteen. And the most easily available is pawadas and samosas and tea probably, or something like that. So making a concerted effort to carry your small dabbas, keep everything inside it and whatever, it takes a lot of learning, which is important. Thirdly, if you have developed PCOS, you are not ovulating as well as you normally would. So therefore, for these people, again, getting all the hormones in order requires a definite lifestyle change. Definite lifestyle change. And also, being able to pick up your own endometriosis. Now, what are the signs of endometriosis? A dragging pain, a nagging pain, getting severe pain just before you start your menses, having a very heavy crampy pain along with either diarrhea or constipation when you get your menses. These are all indicators that probably you have developed something inside. There was something very interesting. One patient of mine had said, like while I was taking a history, she said, "Doctor, there's something very funny. When I pass my stool, there's an indentation on my stool." So she had told this to quite a number of people, and they all laughed at her. Aisa kaise ki you can see something khadda jaisa dikh raha hai tumhari stool mein tumhe. And then when we examined her, we found that she actually had a rectovaginal endometriosis, which when the stool was getting passed was actually causing an indentation there.
Oh my God. Okay.
So I mean, these are small things which should give you. So you should definitely, if you're getting married, before that also you should definitely go to a doctor to have a pre-marriage counseling. Now, why pre-marriage counseling is important is to define to yourself as to how long can you wait after your marriage to have a baby. Now, there is another thing which I would like to add here is, and that is that every woman is born with a total number of eggs she's going to have throughout her life, and that is already there when she comes out of a mother's womb. So the day you're born, you have the number of eggs you're going to, or destined to have. It could be 20. Yeah, that's it. You don't have nothing comes after that. So if you are born with 20,000 eggs, you have 20. If you are born with 50 million, you have 50. If you're born with 100 million, you have 100 million. And interestingly, who is most important for these eggs of yours is actually your nanny.
Yes.
Yeah, it's amazing. I mean, that's how you realize, how genetics is so important. So when your mother was in her mother's womb, the kind of environment your nanny had when she was pregnant determines the eggs your mother will pass on to you, or the amount of eggs. So your nanny is the most important. For girls, their nanny is the most important, you can say, giver. And so she's born with those total number of eggs. And while she comes before she comes into puberty, some of the eggs die off. I mean, they just disappear. And once she comes to puberty, every month about 15 to 20 eggs are used up. So the moment she finishes that particular quota that she was born with, she goes into menopause. Now, what we are finding now is that even at 30 and younger, we have girls who have lower amounts of eggs, lower amounts. Normally, we would have had AMH of 4 or 5. I've got girls at 1 and zero point 0.6, which is very low. Now, if these girls do not go in for an early pregnancy after their marriage, there's a very high chance that when they want to get pregnant, they might find it difficult. So just a regular checkup, your hormones, your thyroids, your prolactins, your AMH levels, how much of an egg level do you have inside you, perhaps would go a long way in making you determine your further courses of action. Because there's a time and tide. Now, nothing better than a woman's fertility, which tells you that there is definitely a time and tide in which you should get pregnant, or you should try to think of a pregnancy, or if for any reason you don't want to, you have egg freezing available to you now, which was never there earlier.
Okay, all right. Because with all the women empowerment movements which are happening, women may know the risks involved, but if they are very career oriented and ambitious, and there's nothing wrong in it, we tell women that, chase your dreams. They are choosing to, like defer having the babies later on in life. And I know when I hear people like you, there is a whole awareness about egg freezing and all that, but I don't know how many women choose it in India now. But
quite a number now. I mean, particularly from the entertainment industry and all, quite a number of them are going in for it. But unfortunately, it doesn't work for everyone. That's one other thing which nature has kept on its own side. It doesn't give you everything. You have to work with nature.
Dr. Sab, after post-pregnancies, and specifically, in the 40s, mid-40s, there are a lot of things that women experience, specifically hair and, usually skin, a lot of issues like that. How do you usually get aware of the fact that these are the red flags that I should address gynecologically, I should approach a doctor?
After I went through my own pregnancies, I kind of feel that the first thing that any woman should have is one of those bitchy gynecologists who keeps on telling you, "Bahut moti ho gayi ho, bahut moti ho gayi ho, bahut moti ho gayi ho." Because most of the time when you are pregnant, everybody says, "Not to chadna hai," like it's okay, you're pregnant. And then when you deliver, then in most cultures, they say, "Nahi, itna to tumhe khana hi padega, itna to tum khana hi chahiye, itna ghee tumhe khana chahiye, itna ye khana chahiye," because, you're feeding the child. That's a big myth. You don't need to eat more to feed more. You just need to be more relaxed and eat the right things. I mean, now you don't have to starve yourself, but you have to eat the right things. The second thing that I think always I feel is the weight. Second is your hair and skin, which we look at in two aspects, because as soon as they finish, when they finish their pregnancies and have their babies, the first 2 months are awful because they have no timelines. They don't know when they're getting up, when they're sleeping, when they're doing. So in those patients, I always feel a massage is a very good thing to do. A massage. Having somebody to help you where you just plonk your child for 4 hours and go to sleep. Being a little selfish about it. Don't try to be the perfect mother. कि जब बच्चे ने ऐं किया फट से उठा लिया, बच्चे ने किया तो फट से. No, keep your timings. See to it that the child is fed, but take your own time. Keep a me time for yourself. Get a massage done. Relax yourself so that you can feed the child. Don't eat more. Go in for a good, nutritious diet, which makes you lose weight. And after 3 months, get your things checked out completely. Because 3 months mein exercise, diet. And when I talk about exercise in post-pregnant women, the most important exercise is not only abdominal and core muscles, but it's also your perineal muscles. This is extremely important. This is generally not done because they feel, "Mera flat stomach ho gaya, mera 10 kilo lose kar liya, bas mera ho gaya, I'm done." But the fact is that every woman who has a natural delivery has, if suppose she has 100 fibers in her perineum, 30% are torn. Even as and when, even in the best of deliveries, 20 to 30% get torn, 20 to 30% get stretched. Okay. So what happens? If you do the perineal exercises, these all fibers, at least the first 30% which have been stretched will come back. And the ones which are torn, because there is approximating of all the fibers, they start becoming strong. If women do their perineal, in fact, every woman, right from the time the girl, in fact, every mother should teach these perineal exercises. In yoga, they're known as Moolband, in which you just constrict your perineal muscles. It's something like you're stopping a urinary flow, you know. I tell my women, go to the loo, sit down, sit on your haunches, start peeing. And when you have just started, try to stop the stream. Somebody suddenly opens the door of the loo. You stop, don't you? So
Yeah.
that is where your conscious muscles take over. Stop, start, stop, start. That's the muscle you have to actually exercise. And there are grades of those exercise. The first is, of course, the stop, start. Second is tighten and hold for a count of 5. Third, which I kind of like, is what I call the lift exercise. Okay, you just kind of tighten your perineum. Think of your perineum like a lift which you're taking up to the 6th floor. Okay,
Yeah.
first tight, then still more tight, then still more tight, then still more tight. Take it as up as you can. Hold for a count of 1, 2, 3, and let go. That's a good perineal exercise, which every woman should learn right from the time she's young. And it is particularly important after your deliveries, because if you don't do these exercises, as of now, nothing may happen because you're still young and the other muscles may take over. But when you grow older, you'll find that it's difficult for you to hold the stream of urine. You have what is known as stress incontinence. Every time you sneeze or cough or laugh, some urine comes out. Or you have what is known as urge incontinence. Urge incontinence is that the moment you think of peeing, even before you reach the loo, it just comes out. You can't stop it. That's an urge incontinence, which is very common in women above the age of 50 and sometimes even in 40s and 60s. So this is particularly relevant to your deliveries. You must do this exercise.
Dr. Saab, those of the girls who have never been married, and I don't know much about their sexual life, and who have not born a child, are their issues when they get older in life a little different or the same as every other woman?
They are a little different. Most of them are sexually active right now, even if they are not married or they don't want to have babies. But either way, it's emotionally definitely more. I've had girls, women, I would call them women now, crying because they kind of feel that they've missed the bus and things like that. And I have right now a 47-year-old who's come to me, and she's working in a glamorous job. Glamorous job is not the word for it. And now 47, she comes and tells me, Doctor, can I have a baby? No. I mean, I am not God, and what is supposed to be happening before 40, getting it between 40 and 50 is possible, but it is tough. It is tough. So the emotional part is very, 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 very touching to me, because I feel, and beautiful girls. I mean, it's not that there was anything wrong with them. That's one. Second is that if they're sexually active, most of them are on contraceptives, or they are in such relationships where they've been told ki acha tum bachcha kar lo aur fir main rakhunga, kind of a thing. So that is a very difficult period and a very difficult decision for them to take. Should I not? Now, there are a lot of legalities to it, which every girl, every woman should be aware of, that if you have a kid out of wedlock, the management, socially and otherwise, is also very difficult. Everywhere you go, your passports or whatever, father's name, this name, that name, it becomes a little not that easy.
Yeah. Dr. Sir, there is a 45 and above. I know how often should women be getting their gynec checkup done, that there are issues with, where people have thyroid, diabetes, heart issues, cardiac issues, and then to get a mammo done regularly. A lot of these things, because of either paucity of time or just laziness, a lot of women do not get it done. So
particularly the mammography part of it, I wanted to talk about. You see, the first thing is every woman should be aware that she has a breast which she can self-examine. And now there are controversies about that also, because they said that you can miss it even on your own self-breast exam. But as of now, this is the best we have, right? You have many kinds of marriages, the polygamous, the androgamous, whatever. But still, the one we have, with whatever its faults, is the best. Similarly, in breast examination, the best is still your self-examination. At least you're aware. Okay, if you feel something different, if you feel generally the pain is not the thing which you should be getting too worried about. But 2 or 3 things which are very important is your bra. Your lingerie should be the best you can buy, like your footwear should be the best you can buy. Okay. Always, that's the first thing you should remember, because the fit of your bra is very important to the pain that you get in your breasts. Now, we all women, I was fortunate enough to be on the panel with Calvin Klein, and there was this woman who was who was responsible for their lingeries, and she was going all over the world. And that something very interesting she told me was that, doctor, the breast shape and size all over the world is very different. So if you compare your breast to a European woman or you compare it to a Singaporean, it's going to be different. We are nearest to the Africans. The Indian women are nearest to the Africans. So whatever brand works for Africans, or even UK, particularly because we have a lot of Indians there. So like that is a good brand. But anyway, the basic about a bra is that your breast should be completely inside the cup, For Indian women, because we are heavy breasted, the straps should be broad. They should be broad. And the back wings also should be broad. So you should not buy one hook or two hook types. You should buy something which is 3 or 4 hooks if you want a complete support. The breast should not be hanging below or above. It should be completely inside and supported as far as possible. And if you do that, the pain in breast would be the most minimal that you get. For breast cancer, the self-examination and then mammography. Now, there are 2 types of mammographies. One is the X-ray mammography and one is the sono. The X-ray mammography exposes you to some kind of rads, okay? When you take too many rads, it is said that it itself would cause cancer. So X-ray mammography should be minimal. Earlier on, this was so every year. Now there's a big no-no. They said don't start before 40. Don't start doing any X-ray mammographies before 40. Before that, if you have a lump, do sono mammography. That's an ultrasound examination. And after that, you can do your mammography every 2 years or 3 years. You can just in the interim continue to do the sono mammography, because that would be just fine for you. If you feel anything different, just see a doctor. And many girls ask me, how do we feel a lump? I tell them, put a small almond inside your bra and then feel. Okay. The feel that you get. And again, you feel not with the tip of your fingers, but with the flat of your fingers. So it's this, it's not this. And you never hold your breast like this. You know, many girls, they hold their breast like this. They say, Dr. Sabha, the lump feel ho raha. When you hold your breast like this, you'll always feel a lump because there is a tissue inside. So that's why.
All right. And all other things like hormone in terms of diabetes and thyroid.
Those for any woman above the age of 40, a baseline test is very necessary. And getting it done almost every 2 years, having a baseline test in which you have your CBC, your basic urine, your sugars, your liver functions, because we tend to have fatty livers very easily, and also your thyroids, prolactin, and vitamin D. I always advise all of that, because with together all of that could give you an idea if there's something wrong. And that is important. The second thing that I was thinking of, that regular testing is important, but a regular lifestyle is also equally important.
Yeah.
So if you're a diabetic, you should be with a guy who's a diabetologist who can treat your diabetes. If you have thyroid, you know that you're supposed to take the medication. But when you're taking the medication, there's something very interesting. You should know your medication very well. If you're taking thyroid medication, you should remember that it kind of hinders the calcium absorption and your bone. So if you're taking thyroid, you should be worried about your bone strength. Similarly, there's certain diabetic medications, not your metformins, but the others, glycolides and all those, in which it does affect the absorption of calcium and bones. So again, your bones can be weak. So people who are on long-term medications like diabetic medicines or antihypertensive medicines should know their medicine and should know their side effects. You should have not the guts, but you should have the temerity to ask your doctor, "Okay, sir, isse kya mere bone mein kuch farak padega? I heard that this was something like this. Would it affect my bone?" And of course, you can also Google it out. You can Google it out. What are the side effects? You should know your side effects, because something like antihypertensives do cause swelling on your knees, swelling on your ankles. So if you know that this is the drug I'm taking and I'm getting swelling, if you find that you're getting headaches, if you find that you're having some kind of a palpitation, it means you should better check your medications also, what you're taking. Because chronic medications can have chronic side effects.
There are so many things we have learned today, and there are so many more things that I can ask you. It's limited. I just wanted to ask you, is there an advice you want to give to women about their health and well-being? And these are such scary times. So I know you've been so busy. I wanted to catch you and let you tell.
I'm so sorry. It's one of those, because I got home very late and then today morning it was like that. Anyway, red flags that I think that was a very nice, this thing that I was thinking of, that we should talk about that. See, when you are young, when you are in the below the 20 age group, the red flags are weight and hirsutism, hair. Okay, these are the red flags which a girl, which a mother should pick up for her daughter when she's in the 20 and 40s. Itching, UTI on and off, vaginal itchings. That means vaginal itching could also be the first harbinger that you have some kind of a sugar issue. Because if you keep on getting repeated vaginal infections, either your husband or your partner is not maintaining proper hygiene. So whenever you are treated, your partner should be treated. But in spite of that, if you keep on getting UTIs again and again, it should be checked out, because there are only two reasons for it. Number one is either your bladder has descended after your deliveries, or the bladder is retaining some amount of water or urine inside it. And third is that you have the beginnings of a diabetic. It's known as impaired glucose tolerance. So you kind of, that's a pickup, that's a sign that you should be. And if you're getting discharges again and again, if you're getting infected again and again, that it means either your health is so poor, your hygiene is so poor, or your partner's hygiene is poor, or you are starting some kind of a diabetic issue or something, which could be the reason why you're getting it again and again. So that's in the 40 age group. The second thing in 40 age group is if you feel very tired, if you feel giddy, check your sugars, check your vitamin Ds. These also, when you find sometimes there's something very strange. You're walking down a staircase and you feel ki balance nahi hai. Yeah, you're trying to stand up on something, you feel balance nahi hai. These are again indicators that you might be vitamin D deficient. So you might as well check that out. Then when you come to your menopause, the red flag is if suppose you get a bleed, you've been menopausal for say more than 2 years or 3 years and you get a bleed, that's a red flag. You should be seeing a doctor immediately, because the bleed could be just a hormonal disturbance, but it could also be the beginning of malignancy. If you have pain in the abdomen, all age groups, check ultrasonologically, because sometimes these little cysts and all could be there, which may be physiological, but they could also be other kind of cysts which are inside. So you should know that.
Oh my God! Today we have a lot.
Have I scared everybody out of their wits?
It's not about scare. I mean, some of us are old enough to have seen some of these things, but actually, you know what? We didn't see some of these red flags that you're talking about, and I wish we were more educated to know about some of these things. We were so busy in our careers that you pop the pill and you go back again to work the next day. So I think this was so important to hear it directly from you, Dr. Saab. And I mean, I'm fortunate.
Because also this is what has happened is we have to realize that most of us are going to be in the 40 plus age groups, because, when in 1940s, the age span was only 30 years. By 1960s, the age span came to 60, and now we are going to go to 75 and above. So, in fact, on the last count, like 1 crore 73 million, I forget now, 173 million ke upar women are menopausal. So, these menopausal women, why we should be kind of teaching them or targeting them is because the menopause, although it's physiological and biological, this is the time when the maximum transitions occur in your body. So if you kind of take it in the right way with the right, you can say, treatment to nahi bolungi, but right lifestyle, right additions, right whatever, combinations and permutations, you would remain healthy for a longer time. You would be active, agile, moving around. I think one thing very nice we can do for anybody going above 40 is to learn how to dance. That's very important.
You're good at that. I know.
It teaches you balance, and it's almost like a Tai Chi. I say, whatever you're doing, it's Tai Chi.
Make our day, and please tell us men are changing and are being more supportive of women's health. They come with them and are looking after it. Aap kuch to dekhte hoge trends that we should make us happy.
I'm very happy. The other day I saw this husband holding his wife's hand and actually I felt quite jealous. I said, wow.
No, your husband is very, very crazy about you and he मतलब इतने romantic है.
So, I mean, the things are changing and men are being more proactive. जो पहले नहीं आते थे ना, वो अब आते हैं, पूछते हैं, करते हैं, and I really like it. And they actually kind of take care of their wives, and they're supportive not only when they're coming to the clinic, they're supportive in the house also. Okay, मैं ये कर सकता हूँ, मैं वो कर सकता हूँ, which is a good trend in a lot of way.
I thought
men are changing. Men are changing, and we have to give them credit for it. They are changing.
Thank you so much, Dr. Shah, for being here today. And I think all the girls are going to appreciate all the great tips that you have given us. And I wish all our members a very, very healthy new year ahead and for times to come. Thanks a lot.
Thank you. Thank you.